If you are over 60 and you've started noticing changes in your sexual performance, especially weaker or inconsistent erections, it's easy to assume this is just normal aging. But what most men don't realize is that this is often not just about age at all. It's usually a sign that something deeper is changing in your body, especially blood flow, nervous system balance, muscle strength, and overall cardiovascular health. And the most important truth is this: in many cases, this can be improved and sometimes significantly reversed, even later in life. My name is Dr. Sophia, a urologist and men's health specialist with over 30 years of clinical experience working with older men. I've seen patients in their 60 seconds, 70 seconds, and even 80 seconds regain stronger, more reliable natural erections without depending only on medication. Not through magic, not through shortcuts, but through simple, science-based techniques that support how the male body actually works. What I'm going to share with you are 4 practical methods that focus on rebuilding your sexual health from the inside out. These are not quick fixes. They are foundational tools that target blood flow, pelvic strength, nervous system control, and tissue responsiveness. When combined, they can make a powerful difference over time. The first and most important step is strengthening your pelvic floor muscles. Most men don't even know these muscles exist, yet they play a direct role in erection quality. These muscles help trap blood inside the penis during arousal, which is what creates firmness and maintenance. When they are weak, erections tend to fade quickly or never reach full strength. One of my patients, a 68-year-old retired teacher, once told me he felt like he was losing his masculinity because of his declining performance. After just a few weeks of consistent pelvic floor training, he noticed a clear difference in control and firmness. He didn't use medication. He simply retrained muscles he had never consciously used before. To activate these muscles, you first need to identify them. A simple way is to imagine stopping your urine mid-flow. The internal squeeze you feel is the pelvic floor. Once identified, contract those muscles gently and hold for about 5 seconds, then relax for 5 seconds. That is 1 repetition. Start with around 10 repetitions, 3 times a day. Morning, afternoon, and before bed is ideal. As your control improves, gradually increase the hold time. Over several weeks, this builds endurance in the muscle system responsible for maintaining erection strength. Many men begin noticing improvements in firmness, control, and even confidence within a month or 2. The key is consistency, not intensity. The second method focuses on breathing and nervous system regulation. This may sound too simple, but it is extremely powerful. One of the most overlooked causes of erectile difficulty in older men is chronic stress activation. When the body stays in a fight-or-flight state, blood vessels tighten, heart rate increases, and blood flow to the pelvic region decreases. I remember a patient in his early 70 seconds who was physically healthy but mentally overwhelmed. He said he felt disconnected during intimacy, like his body just wouldn't respond anymore. The issue was not desire, it was stress physiology. His nervous system was stuck in overdrive. The solution we used was diaphragmatic breathing. This helps shift the body into a relaxed rest and digest state, which is essential for healthy erections. To do this, sit or lie down comfortably. Place 1 hand on your chest and 1 on your abdomen. Slowly inhale through your nose for about 4 seconds, allowing your stomach to rise, not your chest. Hold for 2 seconds, then exhale slowly through your mouth for about 6 seconds. Repeat this for 5 to 10 minutes, once or twice daily. This type of breathing lowers stress hormones, improves circulation, and increases oxygen delivery throughout the body. Over time, it helps the body respond more naturally during intimacy instead of shutting down under pressure. The third method is vacuum pump therapy, which is often misunderstood but widely used in clinical rehabilitation. This device works by creating gentle suction around the penis, drawing blood into the tissue and encouraging healthy expansion. It is not about stimulation, but about restoring circulation and conditioning tissue response. I once introduced this method to a skeptical patient in his mid-60s who had almost given up after trying multiple treatments. After a few weeks of proper use, he returned with surprising results. He said he felt normal again, something he hadn't experienced in years. A medical-grade vacuum device is placed over the penis with a proper seal, and gentle pumping creates negative pressure. This allows blood to flow into the erectile tissue. Once an erection is achieved, it can be maintained for a short period before releasing. Typically, this is done for about 10 to 15 minutes per session, a few times per week. When used correctly, it helps recondition blood vessels and supports natural erectile function over time. It should always be done gently and consistently, not aggressively. The fourth method is penile traction therapy, which is less known but clinically used in certain rehabilitation cases. This involves a device that applies controlled, gentle stretching over time. The goal is not only structural support, but also improved tissue flexibility and circulation. One of my patients in his late 60 seconds used this method after feeling that nothing else was working. Over several months, he noticed improvements not only in firmness, but also in overall confidence and function. He described it as feeling like my body is waking up again. The device is worn for short periods daily, gradually increasing over time. The principle is slow, consistent tension that encourages cellular adaptation and improved blood flow support. While it requires patience, it can offer long-term benefits when used properly. Now, when you combine these four methods, something important happens. You are no longer focusing on just one system. You are training the entire network involved in sexual function: muscles, blood flow, nerves, and tissue responsiveness. This integrated approach is what leads to real improvement in many men. Pelvic exercises build strength. Breathing restores calm control. Vacuum therapy improves circulation. Traction supports long-term tissue health. Together, they create a foundation that supports natural function instead of forcing temporary results. What I want you to understand is that this is not about chasing youth. It is about restoring function, control, and confidence in the body you already have. Aging does not have to mean decline. It can also mean adaptation if you give your body the right signals. Many men I have worked with often say the same thing later on. They wish they had taken action sooner. Others say they feel like they got a second chance they didn't expect. And some even report improvements in relationships and emotional connection, not just physical performance. I cannot promise instant results, and I will never claim that every method works the same for everyone. But I can tell you this from decades of experience. The body responds when it is trained correctly and consistently. Even small daily efforts can lead to meaningful change over time. If you are willing to start with even one of these methods today, you are already moving in the right direction. Progress is not about doing everything perfectly. It is about staying consistent long enough for your body to respond. Thank you for your attention. I hope this gives you a clearer understanding of what is actually possible, and more importantly, what is still within your control.